Welcome to the Safe States Alliance IVP 360 training series. This session, titled Systems, Policies, and Environmental Approaches to Injury and Violence Prevention, will focus on the role of protective factors in our prevention work, understanding how to build partnerships and understand the contacts to advance our prevention goals, and ways to understand whether or not our prevention programs are working as intended. My name is Catherine Guerrero, and I'm a principal at Health Management Associates. I've been working in injury and violence prevention for more than 20 years. I've worked on nonprofit community-based organizations, state health departments, and now in the private sector as a consultant, implementing programming, conducting evaluations, and providing training and technical assistance to public health professionals across the country. Injuries and violence represent a leading cause of death in the United States and cost more than $800 billion annually. That's the equivalent of 85% of the yearly US federal deficit. Nearly 250,000 people died as a result of injury and violence in 2018 in the United States, and more than 27 million people were treated as a result of non-fatal injury and violence-related incidents. Injury and violence take a serious mental, physical, and financial toll on those directly impacted and the loved ones that surround them. The full financial and social impact is immense when one considers the cost of medical care, the loss of work and productivity, the loss of life years, and the cost of the criminal legal response. Beyond the immediate and direct impacts, research suggests a strong link between injuries and violence and later development of chronic diseases. This is largely due to the toll of toxic stress resulting from injuries and violence on the brain and the body. Toxic stress is a type of stress that results from severe or repetitive trauma. Toxic stress can result from a variety of injury and violence prevention stressors, including child maltreatment, interpersonal or community violence, or disasters, just to name a few. Toxic stress can also result from circumstances experienced by people who have lower socioeconomic status, and who experience racism. And this last point is important because we know communities of color and other communities who historically had less access to public health resources are more at risk for these types of stressors. At the same time, these communities often experience higher burdens of injury and violence. Understanding these disparities is fundamental to injury and violence prevention work. And this means health equity and the application of a health equity lens to our efforts is essential for all injury and violence prevention professionals. Everyone should be safe from injuries and violence, but our country has long established systemic barriers rooted in oppression that result in people of color, those who are economically disadvantaged, people living with disabilities, those who are geographically isolated, and those who are lesbian, gay, bisexual, transgender, or queer, not having equal access to social and economic resources that can protect against injury and violence. These disparities impact our economy, costing the country trillions of dollars. They impact our ingenuity and our academic achievements as we're unable to draw from the full range of the best and brightest minds. And they impact our social and emotional health as we're hampered in building relationships across diverse cultures. You can see by the examples listed on this slide, disparity in access to prevention results in negative outcomes for many communities. The social determinants of health are non-medical factors that influence health outcomes. They are the wider set of forces and systems shaping the conditions of daily life. These forces and systems include things like economic policies, social norms, access to quality education, access to employment, job security, work-life conditions, and food security. The social determinants of health can influence health equity in positive and negative ways, and they're important elements in strategies to prevent injury and violence prevention. The good news is that injuries and violence are preventable, and we know a lot about how to change the current reality. When we look to design strategies to prevent injury and violence, we have to understand the risks that increase the likelihood of individuals and communities experiencing intentional or unintentional injury. And we need to understand the protective factors that we can leverage to keep individuals and communities safe and minimize the negative impacts of injuries and violence when they do happen. Risk factors are those characteristics, either contextual or organic, that increase the likelihood that we'll experience a specific injury and the likelihood that the outcomes of that injury will be more severe. Protective factors are those characteristics, either contextual or organic, that decrease the likelihood of negative outcomes and reduce the negative impacts of risk factors that may be present in our lives and communities. Social ecology is likely something you've seen before, but we include it here to remind us all that individuals are impacted and influenced by risk and protective factors operating at multiple levels. While many, if not most, prevention programs are focused on shifting individual level skills and resources, it's important to note that the work at the higher levels of the social ecology, the community level or the societal level, have larger potential to shift population health outcomes. Given this, it's important to think about where and how our work is concentrated. At what levels are we working and not working? And how is our work part of a collective effort with our partners that's contributing to the development of a system of prevention in our communities? Using this model can help individuals, groups, and policymakers consider the complex interplay among all the levels of the social ecology. It can help people understand the range of factors that put people at risk for violence or prevention from experience or perpetrating violence. It helps us visualize the overlap in factors and the influence of factors across the levels. And it can help us realize that we need to act across multiple levels, that we need interventions at each level of the model. There are risk and protective factors that are shared among types of injury and violence and have the potential to impact more than one public health issue at the same time. This idea is important for our work because it means we can design intervention strategies with the ability to improve multiple population health and quality of life outcomes. But in order to do this, we have to look upstream at factors that impact the social determinants of health in ways that are positive and increase equity. And we have to build new partnerships across multiple disciplines. Prioritizing risk and protective factors linked to multiple forms of violence will create the opportunity to streamline and scale prevention planning and approaches across agencies and organizations. This approach is gaining recognition in state and local public health departments working on both intentional and unintentional injury prevention. As we think through our work and try to make it more connected and more aligned across public health issues using shared risk and protection, we need to keep a few things in mind. Like I said, the goal of a shared risk and protective factor approach is to address and impact more than one population health or quality of life outcome at a time. For example, instead of implementing a program only to reduce teen suicide, a shared risk and protective factor approach would include implementing an intervention that addresses teen suicide and at least one other outcome, such as substance abuse or substance use among teens. Secondly, positively impacting the social determinants of health involves intervening in damaging cycles, things like poverty, economic equality, structural racism and the way it impacts communities, and reinforcing beneficial cycles, so increasing equitable access to education or destigmatizing mental health care. Shared risk and protective factor approaches can include interventions across the social ecology. And lastly, using a shared risk and protective factor approach requires working across disciplines and across sectors. It may require us to partner with new partners that we've never thought of before. The graphic here is an illustration of individual level risk factors shared by the 6 public health domains in the small circles on the right. I'm going to give you a real sense of what I mean by shared risk and protective factors and how they might be useful for your work. Being able to identify and understand how these risk factors are shared allows you to design programs focused on, for example, increasing educational achievement, and then ultimately measuring impact in all of these public health areas. Here are some relationship level risk factors that are shared again by the public health domains in the small circles. Again, if we were to design programs to increase parent-child connectedness, say, we would expect to be able to measure impact in youth violence, child abuse, neglect, suicide, and the other domains shown here. There are community level risk factors shared by these public health domains: sexual violence, bullying, youth violence, child abuse, and neglect. Again, by working to impact community violence, or neighborhood poverty, we should be able to affect change in these public health domains. And lastly, the societal level. So here are risk factors, societal level risk factors shared by these forms of violence and injury. When designing programs, we can find the same type of shared solutions within protective factor research. So this slide shows 4 different types of violence for which the coordination of resources and services among community agencies is a protective factor. And here again, we can see protective factors shared across all these domains at multiple levels of the social ecology. So viewing these slides, you can see how applying a shared risk and protective factor approach to your injury and violence prevention work can increase your impact, create efficiencies in your daily work, and connect a broader group of partners working towards a shared goal. While the concepts of risk and protection are more well-defined in intentional injury or violence, new efforts are being undertaken to apply the approach to unintentional injury in areas like drowning, falls, and highway safety. Here's an example of a recent report published by the National Highway Traffic Safety Administration, or NHTSA, and Safe States that documents the identification of shared risk and protective factors for changing driver behavior to improve safety. Knowing that there have been significant gains in engineering and policy strategies that have made cars safer, roads safer, and compelled safer practices among drivers, NHTSA wanted to look at additional strategies focused on factors targeting driver behaviors like aggressive driving or distracted driving. So in this slide, you can see some examples of risk factors down the left side of the slide and driver behaviors that run across the top. The X in a box represents where there's research to support a relationship between the risk factor and driver behavior. The lack of an X doesn't necessarily mean there's not a relationship. It just means we don't have research at this point in time. These risk factors are at the community, relationship, and individual level. And here are more risk factors at the societal level. Again, we also have shared protective factors for driver safety. In this slide, you can clearly see protective factors related to 2 or more driver behaviors highlighted in green. This means if we work to increase the presence of this protective factor in communities, we should expect to see positive impacts in all of these behaviors. And here's some additional protective factors at the societal, community, and relationship level. Again, those risk factors or those protective factors impacting 2 or more driver behaviors are highlighted in green. So we know that increasing access to community-based youth programs, increasing economic resources, and implementing universal seatbelt laws are promising areas to focus our energy on in improving driver safety through changes to driver behavior. So how do we talk about risk and protective factors when we're designing programs? Traditionally, injury and violence prevention and intervention strategies have focused almost exclusively on risk factors and their elimination. But we now know that changing the balance between risk and protective factors so that protective factors outweigh risk factors is a more effective prevention and intervention strategy. Helping individuals, families, and communities build resilience, develop skills, increase knowledge, develop relationships that offset risk exposure can contribute to both short and long-term positive outcomes. Using a protective factor approach can be a positive way to engage communities because it focuses on strengths and what they've been able to accomplish already in spite of historic and systemic barriers to well-being. Focusing exclusively on risk factors can leave families or communities feeling stigmatized or unfairly judged. So using a protective factors approach can provide a strong platform for building collaborations with partnerships with other service providers that can help reach community members and support implementation of prevention programming in communities we haven't historically partnered well with. So why a primary focus on protective factors? Well, protective factors are conditions or attributes of individuals, families, communities, or the larger society that promote well-being and reduce the risk for negative outcomes. So we know that protective factors buffer the effects of risk exposure and may help individuals and families negotiate difficult circumstances and fare better in their schools, work, and their life in general. Positive long-term outcomes related to health, school success, and successful transitions to adulthood typically do not result from a single program or a single intervention. But focusing on protective factors offers a way to increase resilience across interventions that are being implemented by partners. And in the short term, support the development of skills, relationships, and opportunities that can contribute to improved well-being and positive outcomes over time or in the long term. So in this sense, protective factors can be used as interim indicators to monitor progress of our programs, the progress towards desired impacts that may be not realized for many years. We'll talk more about this shortly. Here's an example of how a shared risk and protective factor approach can be helpful to a community. So developing a positive school environment has showed is a good example for us, right? So a positive school environment is one where teachers and staff in the school are focused on supporting youth, particularly youth that have a higher level of risk in their lives, where there may be specialized school-based programming geared towards improving outcomes for youth at higher levels of risk. What we see when we create a positive and supportive school environment are reductions in traumatic stress disorder, reductions in psychosocial challenges such as anxiety, sleep disorders, depression, and reductions in dating violence. We also see improvements in school performance and resilience. So this shows you the range of beneficial outcomes related to programs focused on improving school environments in public health issues such as teen dating violence, mental health, substance use, teen pregnancy, and others. Here's some more examples of programs that have the potential to impact a number of injury and violence issues. You can see the breadth of strategies connected to each of the protective factors, even in just these few examples, which means that we can apply these strategies in ways that are reflective of the unique context or the unique needs of communities that we are partnering with. And again, considering the multitude of risks present for many communities, addressing shared risk and protection allows us to mitigate the impact of adverse social conditions and potentially change the systems that preserve disparities. When we think about individuals and families living in communities where there are many risk factors and structural disparities, and the increased risk that comes along with that, we should think about protective factors that can address a broad range of those risks. One example is community cohesion. Community cohesion is the ability of local communities to include and support all of the people who live there. A cohesive community is an inclusive community. It's a community where people connect and coexist in ways that are beneficial to everyone. So in neighborhoods where there's low cohesion, and where residents don't support and trust each other, people are at higher risk for perpetrating child abuse and neglect, for being a perpetrator or victim of intimate partner violence, for sexual violence, teen dating violence, youth violence, and suicide when compared to neighborhoods with high support and cohesion among residents. Building cohesion within and between communities is an essential step towards improving people's quality of life. Social inclusion creates happy, confident individuals and empowers them to engage socially and economically. So we can use these different indicators of conclusion to study different groups, to understand the conditions that they face in their communities. So taking the case of women and girls, looking at the conditions of inclusion can tell us a lot about the risk of violence against them. So when women are underemployed or employed at lower rates than men, or hold fewer leadership positions, or are limited to jobs with low levels of advancement potential, they're at higher risk of violence. This is especially true when women are impacted by multiple systems of oppression that compound the gender difference, such as racism. So this is how we can use protective factors and shared protective factors to understand both what the needs are in our communities and what the potential solutions are to addressing these public health issues. Over the last few years, I've worked with safe states to support a number of state and local health departments as they design and implement shared risk and protective factor approaches. In this work, we see some patterns in the protective factors that appear regularly. Although the specific strategies and nuances of the programs being implemented are different based on the community context, we see a lot of focus on economic stability, knowing that unless we grow income for low-income families, the wealth gap associated with health inequities will never shrink. So with basic income security, families and communities can grow their wealth, save money, and invest, right? So some of the strategies being implemented in communities are to think about equitable procurement, right? How does the state government, city governments put resources into communities? How do we build job pathways that lead to sustainable employment? How do we advocate for universal basic income so people can have their basic needs met regardless of employment status? How do we provide opportunities for people to save and invest? And how do we improve access to capital so that people can start businesses? So now that we've talked about designing prevention programming to prioritize protective factors and apply a shared risk and protective factor approach, let's talk a little bit more about the context in which these programs happen. Usually when we engage in planning for public health interventions, we think a lot about some aspects of context. Is this a rural community or an urban community? What's the economic situation of the people in this community? How diverse is this community, and who's the audience for our programming? But other aspects of the context we maybe don't think about enough. And those are the social and political context of our programming. Considering social and political will requires us to ask ourselves questions about how community members see the influences of health. What are their priorities around health? How does this differ from our analysis about what's happening in this community? How does it differ from the analysis of those people making policy and are making budget and finance decisions that support the public health and prevention work in these communities? If we want community members and government leaders, organizational leaders to buy in and partner with us to execute the strategies that we think are most important, we need to make sure that we're all in alignment, and we need to understand that the ideas that we have are the right ideas based on what the community sees. Most population-based public health approaches that could prevent death and disability require some sort of social and political support to be sustained and have any real impact. Social and political will are the levers to funding, community engagement and support, and ultimately to policy change. And these policy changes are important because they include things like the way we distribute money and resources to communities, how we change the context in which people go to school or live. Is their house safe? Do they have crosswalks and safe ways to get to school? These policy changes include creating more access to resources that meet basic needs, as well as to controlling infectious disease or reducing smoking. So once we've identified priority risk and protective factors, and we understand their potential impact on the health and well-being of the communities we're partnering with, we have to think carefully about the context in which we aim to implement these programs, particularly the political context. As public health professionals, we're often focused on finding the best technical answer to a problem. While we can go through the process of identifying solutions through the use of public health science, navigating politics will be necessary to get our solutions implemented on the ground. Given this, political analysis is an important part of program planning and needs assessment. Our ability to garner buy-in from communities as well as organizational and government leaders, get engagement, get funding, get the attention of the media is often dependent on how well we understand how people and policymakers view issues of injury and violence and how they think about the best solutions to these issues. Our goal is to identify and motivate people to work together to create collective action, to eliminate barriers, to increase the legitimacy of our programming, and to sustain these efforts over time. So we have to understand who is important to create the specific kinds of change we need. What are the important players? And we have to understand, and we understand this, who these players are, through an analysis of the politics and the power operating in these communities. When we aim to analyze power and influence the ways, and the ways they function in the communities we want to partner with, we need to start with the acknowledgement that power is distributed unevenly in our country. Communities of color, LGBTQ communities, poor and under-resourced communities do not have access to the policy and decision-making processes that are most influential in creating the containers of our daily lives. This is true at the local, state, and national level. In order to begin to change this and ensure our health strategies contribute positively to all aspects of well-being for all communities, including the ability to influence our own realities, we need to truly understand the way power is operating and how we should respond to it with strategy and finesse. Here's some questions that we'll need to be able to answer for ourselves as we design our prevention programs if we want to be able to have successful implementation and shift the power that creates barriers to our outcomes. Additionally, to ensure our actions are taken in authentic partnership with communities and have the highest possibility to maximize community engagement, we need to take the time and effort to understand the view from the inside. What are the experiences people are having? How do they define and prioritize their own needs? And how can we support efforts and share resources that will build up the ability of communities to meet those needs themselves and sustain ongoing improvements in health and well-being? Essentially, how do we support and leverage what communities are already doing and are already capable of doing if given the right resources? Here are a set of questions we can ask ourselves to understand or at least relate to the community point of view. Well, I've been talking about power analysis as a specific component of program design. It's also part of a larger set of actions that fall under the category of formative evaluation. When we evaluate programs, we have a number of different motivations that can drive that evaluation. We may just want to improve a program and understand how it works. We may want to support advocacy efforts that advance the issues involved in the program. We may want to make funding decisions or even decide to eliminate a program altogether. Whatever it is, we should be clear about why we're evaluating a program. The purpose of the evaluation will guide the types of evaluation activities we implement. Here I show you the difference between two major types of evaluation, formative evaluation and summative evaluation. In short, an old sort of kind of famous summary of formative evaluation versus summative evaluation is that a formative evaluation is when the chef tastes the soup. A summative evaluation is when the diner tastes the soup. So you can see here the types of activities that would be involved in a formative evaluation versus a summative evaluation, where the goals of a formative evaluation are to learn and improve. So we conduct these evaluations to gather data that can guide that program improvement and form or shape the program to be able to better make its intended impact. So this chart outlines some of the basic but important components of formative evaluation as opposed to summative evaluation, right? So our goal is to identify the program weaknesses or gaps and figure out how to address them. It happens either before a program is implemented or early in the program implementation phase, right? So we can understand what the needs are that we're intending to address. We can plan and design an appropriate intervention, and then we can ensure quality implementation with high levels of fidelity to make sure that we can reach our goals with the program. Here's some of the activities that fall under formative evaluation, right? So we can conduct needs assessments, which are aimed at clarifying the needs of the target population, understand how much that need is actually already being met and what else we could do. We can develop tools as a part of a planning process that outline what our proposed solution is. So either a theory of change or a logic model, clarify who's the intended beneficiary and how do we know what success looks like in our program. And then we can consider implementation and process evaluations, which once we've started to put the program into action, once we've got activities happening, we can collect data with which to understand what's actually going on. So is what's happening in the program what we intended? Are we reaching the right people? Are we using the right training materials? Are our timelines the timelines we intended for program delivery? And then are we coordinating correctly with other programs and activities? So this formula, these steps, these parts of formative evaluation are used to make mid-course corrections, right? To shed light on what's happening and what could possibly be getting in the way of reaching the goal that we intend. So designing a formative evaluation approach for shared risk and protective factor projects should be given the time and attention it needs. Tools, like I said, such as theories of change and logic models will be important for highlighting the underlying assumptions and logic about a program and help ensure the program design is reasonable, relevant to the audience, and has the potential for success. These are complex programs, right? And so ultimately could be just as complex evaluation. But in light of that, here's some considerations that we want to think about as we're moving through both the design and implementation of a program and then a formative evaluation of that program. It's important to have clear mission, strategies, structures, goals, and objectives for the programs, right? Before we can even think about what we're going to measure, we need to know what we're doing and why. Developing theories of change and logic models to identify links among program activities, outputs, and outcomes can really help us define appropriate measures, help us understand what our assumptions are that might be hidden in the program and that might confound any success that we're hoping to have. We need to be really clear about what it is we're trying to achieve with the program, and make sure that the activities align with those goals, right? Is what we're intending to do or what we're actually doing reasonably going to lead to what we want to see come out of the work. When we're thinking about our measures and results, we want to be clear about the purpose of the evaluation and how the results will be used. We want to review priority measures regularly to understand how the program might change and establish whether these are still the right measures. We want to work with a realistic timeline and budget. We want to keep the number of measures reasonable, not overwhelm our audience or overwhelm ourselves. But at the same time, we want to think about who our priority audiences are and what are the measures that would allow us to speak to those audiences and address their concerns. And then we want to communicate effectively, right? We want to use clear and concise messaging, easy to understand, and again, relevant for the audiences that we're targeting. And then we want to think about stakeholders at every step of the evaluation and really every step of the program design, starting with the needs assessment, right? Before we've even come up with a solution. We want to build measures reflective of the intended recipient's view of the problem and that match their priorities around solutions and needs. And then we want to develop multiple owners for the results of the evaluation, right? We need to ensure sustainability. So what will we do with what we learn? Who will be responsible for making changes? And who will be responsible for moving forward the program as it evolves? So I hope that this session has been helpful in showing you how to think about prioritizing protective factors in your prevention programming, how to think about using a shared risk and protective factor approach. And additionally, I hope I've made it clear the importance of considering the social and political context of your program and using a formative evaluation to ensure that the program is working as intended and will lead to the outcomes that you hope for. I appreciate your time in listening to this module. So I hope you'll visit more of the IVP 360 modules to learn about other types of evaluation and program considerations.